Hello, this is Dr. Eric Bricker, and thank you for watching A Healthcare Z. Today's topic is predictors of high ER utilization. So, 70% of hospitalizations in America start out in the emergency room or the emergency department. Now, okay, that begs the question, well, where are the other 30%? Well, a lot of those are from labor and delivery, having a baby. So, woman comes in, she goes straight up to the labor and delivery floor. She doesn't have a quote-unquote ER visit, right? So, the vast majority of hospitalizations, though, they start out in the ER. Okay, well, let's look at it the flip opposite way. 13% of ER visits result in hospitalization. Okay, so there's gobs of people that go to the ER, but they don't end up being hospitalized. So if you were to draw a picture of that, you've got this is the ER, and that's the top 13%. Okay, then they get admitted over to the hospital, and then 70% of those people who are in the hospital actually came in through the ER. Okay, so then if we're going to decrease hospitalizations, then we got to decrease the ER visits. Okay, well, to decrease ER visits, let's look at the people who use the ER a lot. Those are high ER utilizers. And there was a fantastic study, I'll leave a link in the show notes. It was a meta-analysis of 11 different studies examining high ER utilizers. And they defined high ER utilizers as folks that had 4 or more ER visits in a year. And on average, those folks had about 7 ER visits in a year. And there are some basic characteristics about these folks that use the ER a lot. 1, demographics. They tended to be young and middle-aged adults, okay? 2, there was only a slightly higher percentage of them being female, okay? Now, 60 to 70% of them had no college education or degree. Okay, so in other words, the majority of them, they either had a high school degree or they had no high school degree. So they were on the lower end of education, and they also had a lower income. And then interestingly, if the person self-reported and perceived to be in poor or only fair health, in other words, if they themselves perceived themselves to be on the lower end of health, are you in good health? No, not really. If you said that, then you were 2 times more likely to be a high ER utilizer. Now, people could, how people perceive their health is very subjective, right? They could be on death's, it's a classic example like the farmer, right? Farmers could be on death's door and they're like, no, I'm doing fine. And other people, they could only have like a slight problem. They could be, oh, I'm in terrible health. Okay, so it's the perception of their health that makes them twice as more likely to be high ER utilizers. Okay, now, mental health, huge influence on high ER utilization. 62 to 77% of high ER utilizers have a previous diagnosis and prior treatment for depression, anxiety, bipolar disorder, or panic disorder. Now, other demographic or other sort of mental health addiction characteristics, if you were a current or a prior tobacco user, you were 51% more likely to be a high healthcare utilizer. Also, if you had alcohol or drug abuse, substance abuse treatment or problems, then you had you tended to be a higher ER utilizer as well. Now, let's look at the specific diagnoses of people that were high ER utilizers. So the diagnoses that these folks tended to have were COPD, which is chronic obstructive pulmonary disease, otherwise known as emphysema or chronic bronchitis, asthma, diabetes, coronary artery disease, migraines, chronic pain, including things like chronic back pain and chronic abdominal pain, prior stroke, allergies, pregnancy, childbirth in the past, or being in the post-partum period, meaning within 6 weeks after delivering a child. HIV, hepatitis C, and cancer. Now, if you had one of these diagnoses, you were 28 times more likely to be a high ER utilizer. So these diagnoses were huge drivers of high ER utilization. Now, having not just one of these conditions, but having multiple chronic conditions also increased your likelihood of being a high ER utilizer. So for every additional chronic condition. It's very common for people to have diabetes and coronary artery disease. It's very common for people to have diabetes and asthma. It's very common for people to have chronic pain and migraines. It's common for people to have cancer and diabetes. In other words, you've got multiple of these. Okay, so for every additional chronic condition that a person had, then they added there was a 43% increase in the chances of being a high ER utilizer for every chronic condition that you had. And if you had 3 to 5 of these conditions, then you were like 5 times more likely to be a high ER utilizer. Okay, so your overall disease burden had a lot to do with it. Now, interestingly also, were these people like only using the ER? The answer is no. Like, what was their other healthcare utilization like? They actually tended to use outpatient office visits too, where the average high ER utilizer had, on average, 5.5 outpatient visits a year. So it wasn't like they were only using the ER, and that visit could have been a primary care visit. That visit could have been a specialist visit, but they were actually going to the doctor in other settings as well. But obviously, it was not effective. It was not effective in keeping them out of the ER, and it was not effective in keeping them out of the hospital. Which, of course, as you know, here on A Healthcare Z, I'm a huge proponent of, because keep in mind, those office visits, fee for service. Those office visits, 8 to 15 minutes. Those office visits had to be scheduled out 30, 60, 90, 100 days out. Okay, so in other words, they weren't same day, next day appointments. They weren't long appointments, and you had to wait weeks or months, and you had doctors that weren't even available at night or on the weekend. So of course, when you're in an environment where your office visits like that, of course you're going to use the ER. So what do high ER utilizers like? What are the predictors of high ER utilization? Well, that's what I wanted to share with you today, and thank you for watching A Healthcare Z.